My name is Dr. Jonathan Walker with Ocala Integrative Medicine, and I've been a ChiroTouch user for about a year and a half. We essentially went with ChiroTouch based on the recommendations of a lot of colleagues and a lot of other doctors that I'd worked with, and I liked the customization aspect because a lot of what I do in my practice is personal injury, and as a consultant my company's PI Marketing Elite, and so having proper documentation, having proper narrative reports, SOAP notes that are optimized for the claims adjusting software, those things are very important to me, and I like that with ChiroTouch I could customize and make the notes work exactly how I needed them to versus being stuck kind of in a tailor-made sort of format. So really for me the biggest thing with ChiroTouch was the fact that it was customizable, and I liked that it was an all-in-one type of feature where everything integrated together, the SOAP notes, the billing, the scheduling, and it's allowed me, because of that, to keep a much better handle on the practice from a management side, being able to see what staff is doing what, patients in the flow and the check-in and check-out. So it's nice to have kind of a snapshot where I can look at the entire practice versus having to be segmented in multiple different software programs. From the SOAP note side, one of the biggest things that I've seen is the ability to speed up how I take notes and take notes that are much more high quality, much more legible, and much more compliant than the ones that I was doing before with paper. Because, you know, in my experience, you simply can't get the same level, the same quality and depth of notes with paper that you can with an EMR system. And because of the kind of button-style interface that ChiroTouch uses, it makes it very easy to put together a really nice note. It doesn't look canned and prefabricated because of how we've been able to kind of randomize visit to visit. And so for me, with what I do with personal injury, that was very important because, you know, I know for a fact every one of my notes is going to be read by the patient's attorney, also by the insurance adjuster, and if the case goes to deposition or trial, by a defense attorney and a host of other adjusters. So it's different than practices where you just sort of kind of hope your notes aren't going to be seen. We know for a fact all of our notes are going to be scrutinized, and it was that important that we had notes that were bulletproof. I can say from a time efficiency standpoint, I'm not having to take home charts at the end of the day, which, you know, my wife is thrilled about and I'm obviously thrilled about. And so it makes it real easy to be able to transition and kind of leave what's at the office, and when I'm done, I'm done. And that's a really good feeling.